This is a talk about tactics to avoid sickness and death. We've got a pandemic of serious viral illness in our country. People are getting terribly sick. Some die. Let me plead with you to follow medical advice. Listen to Dr. Fauci. Read the CDC recommendations. That is where you should start. The question I put to you is this. People get sick and die. Will it be you? Will it be someone you love? I ask myself these questions after a new book that points out the rigid mathematical certainty of how viruses spread. If you know a few numbers, you can make a prediction. I like to see numbers, and I know how to write software, so I ran some numerical predictions. I learned a few things I want to share. Back to the book first, however. Here is what the author has to say. He is Dr. Nicholas Christakis of Yale University. Christakis is a doctor, he is a public health expert, and he is a damn good writer. He wrote a new book on coronavirus called Apollo's Arrow. I highly recommend the book. It is full of information, history, and sympathetic stories from his work with patients in hospitals. Here's what Christakis has to say about the progression of this epidemic of coronavirus. The outcome of the pandemic was inevitable almost no matter what we did. All the noise on the news and the internet about what politicians did or didn't do has obscured the fact that we are in a serious public health crisis because that is what the virus does. Viruses spread. Viruses make people sick. The epidemiology of the virus dictated predictable damage. The good doctor says it is predictable. Well, then tell me the future. Instead, his book gives us 6 scenarios. Buy his book, read the 6 yourself. As a nerd, I ask myself, what do the numbers actually look like when you run the predictions? More importantly, I ask myself, will those numbers tell me something I need to survive? They do. Here are just 2 results that I will explain later. The curves in the plot on the right, top right, illustrate the popular phrase, flattening the curve. Below it, there are curves that illustrate what you should know about survival. We should all follow the CDC guidelines, sure. On top of that, I recommend you game the system. If you play your hand right, you get to the other side of the epidemic outbreak unscathed. You're a winner. The other people, most people will deal with illness, sometimes death, and with the pain of losing loved ones. I call that losing by any measure. Let me explain why different groups of people suffer different fates. An epidemic ends when enough people have been infected or have been vaccinated against the disease. The plot on the right shows the predicted results for 2 groups of people of equal size of 54 million people. I'll explain the plot better later on in the talk, but for now let us ask what percentage of the people stay healthy in each group. The magenta line shows the percentage of healthy people in a typical group. The magenta-colored curve starts out at 100%, which is the top of the plot, over on the left, which is 0 days. The first day is when the virus reached our country of 300 million people. When the virus reaches this typical group about 200 days into the simulation of the pandemic, the magenta line falls as people get infected. Then it levels off after about 350 days when 75% of this group, or 41 million people, have been infected. Most of the 41 million will recover, but many will have a long, difficult road to recovery. The second group fares better. Consider the green curve. This group of people gets sick starting at 200 days, but when the magenta curve flattens out, so does the green curve. And at the end of the epidemic, this group has flattened out, no more infections, when only 8% are infected, or about 4 million people. What I'm asking you to consider is whether you want to be part of the first group, let's call them losers, or the second, let's call them survivors. How did they survive? Well, they waited out the pandemic until the first group had all of its sicknesses. They let other people get sick for them. The difference between the 2 groups is the propagation parameter of the virus, R0. For this coronavirus, R0 seems to be 3.0 for what experts call a naive population. That never happens after the first start of the pandemic. I've used an R0 of 1.8 as a wild-ass guess about what happens in a typical population that listens to the news. For the second population, I've assumed R0 is only 0.9. That is only a factor of 2 better than typical, but it is enough, it's below 1, to damp out the internal spread of the virus in the second community. Some of the winners still get sick, but that is because infections are imported from the typical population. When most people have gotten sick already, no more infections reach the winners. They survive because they waited out the epidemic and let the other guy get sick and acquire herd immunity. The second group made a sacrifice for sure. They took reasonable precautions and didn't develop pandemic fatigue. If they took any risks, they made reasonable bets like waiting around until the virus reached their geographic area before upping their game. For us in the US, that would have been a high risk because we weren't testing much here. We couldn't detect the start of an outbreak in a particular community. But for the future, know that the most important actions you take are the precautions you take while the virus is circulating in your immediate surroundings. So now I've let the secret out. It is a secret the mainstream media haven't told you. Next time you hear someone say that the virus is a hoax and the people packed into ICUs are paid professional actors, you should ask yourself this question. Do people believe that crap, or are they just asking you to go about like nothing is happening? So you get sick, and your loved ones get sick, and they can survive? I've given you my main point. My point is fundamentally unfair and divorced from ethics. So it goes. My generation wanted to improve the world. Look at what you got. Take this message or leave it. Live long, prosper, and build a better world. If you give me more of your time and continue this video, here's where I'm going next. There can be no doubt that I've grossly oversimplified the situation. I wanted to get to my point quickly. I felt you should hear the idea, so I jumped right in. I should have warned you about the simplifications, but to do that, I need to talk more about how simulations work, how the dynamics of an epidemic work in the simulation. That is the next step. I review some basics and illustrate how things work with some simulation results. Along the way, I'll point out assumptions that can't be proven given our lack of real-time data about our society. Also, an examination of the simulation results reveals a few additional points of interest you may not have heard about before. Perhaps some of you will want to go deeper and learn more. If you are in that category, I will point you to a web page with technical details. In fact, the references are on the screen right now, and I'll bring them back later. Now, to the background. First, let me remind you that when a new virus enters a population, the number of infections can grow exponentially at first. To illustrate this, we see on the right of the screen black dots representing a scattering of people in a region. Once the virus reaches one person, that person is likely to infect others. For COVID, all the early studies showed that each infected person infects about 3 others on average. Of course, those 3 go on to infect 9 more. The process just rolls along from there, jumping quickly from 1 case to 40. This is an example of exponential growth. The fast increase causes a cascade of infections that abates only when a significant fraction of the population has been infected and then becomes immune. The reproduction rate of the infections in a population is an important consideration for predicting what will happen. Initially, the reproduction rate is just controlled by the virus. We call this starting point R0. However, if the virus infects people and they become immune, it is harder for the virus to find a new victim. So the reproduction rate drops during the epidemic to what we call the effective reproduction rate, R effective. In aggregate, in addition, people are generally intelligent, and they modify their behavior in the face of an epidemic or any other threat for that matter. Their vigilance will act to lower the reproduction rate even further. I will just denote this actual reproduction rate by R. Let's now consider what happens when the coronavirus reaches a population and how that depends on the reproduction rate. The figure shows the number of infections active on a given day as a function of the number of days since the virus entered the population. You can see clearly that the effect of decreasing the reproduction rate is to lower the peak on any given day and spread out the epidemic. This is the one prediction of models that medical experts have been hammering into us since the start of the epidemic. Everyone can help out the hospitals by changing our behavior to reduce the reproduction rate. If we flatten the curve, hospitals will not be overwhelmed with too many patients in any one day. These curves rise rapidly, just as we expect for a process that grows exponentially. In fact, the empirical value of R0 being 3 was determined by examining the fast rise of cases when clusters of cases first appeared. But a computer simulation must connect the reproduction rate per case with the growth in time. To get the timing right, the simulation should take into account how fast the disease develops in its human victims. Here is a high-level diagram of how that works. When the virus enters the body, it starts to multiply. Eventually, the virus creates enough copies of itself that the copies escape and try to infect other people. After a victim is infected, there is a delay of some days before the victim has enough virus to begin infecting others. Scientists call this delay the latent period. This delay slows the spread of the virus. After the latent period, the victim will infect others until they get their own infection under control. Then we assume they are no longer infectious. Only time will tell how true that assumption will be. The other aspect of the disease is the damage to the victim. Symptoms don't appear immediately. After a person is infected, there's a span of time when the victim does not know they have been infected. That is called the incubation period. The really nasty trick of COVID is that there are about 5 days after the victim becomes infectious before the victim shows symptoms. People spread the disease without knowing they are sick. This period of asymptomatic infectivity has complicated attempts to limit the spread. Now you know the basics of what goes into predicting an epidemic. Predictions, however, have their limits. Everyone wants to know what the weather will be tomorrow and the day after. You must realize the weather forecast can be wrong. The weather report is often wrong, even though the meteorologist has a great pile of data provided from a web of weather stations sprinkled all over the globe. Anyone predicting an epidemic has more trouble. Currently, epidemic predictions are so inaccurate that the actual numbers have almost no utility whatsoever. For example, the first predictions claim 200,000 Americans might die. As I speak, the actual number is more than twice that and still growing. It should not surprise you then that the predictions I just showed of a fast rise and fall in the number of infections hasn't played out in the real data. Just a glance at the real data shows that the actual epidemic drags on much longer than any simple model predicts. That is probably why medical experts don't appear in the media dragging out maps or graphs of future illnesses derived from a computer simulation. They are not like weather people who proudly display maps of predicted path for a snowstorm or a hurricane. The problem with prediction is that we don't have the tools and procedures to observe mankind the way we observe the atmosphere. There are virtually no data on how society is wired together with living arrangements, social connections, and travel for work and pleasure. In spite of that, running models can teach us lessons that are useful. The computer simulations correctly model the way a virus spreads given the assumed model for the population. Our problem is to select a model that gives us a valuable warning and other models that teach us how to understand and react to this crisis. One thing our models need is the idea of travel. That is why I'm showing here a picture of the Mosel River in Germany. I was supposed to be cruising on a ship on that river in 2020, but Germany got locked down, I got locked out, it didn't happen. Meanwhile, the virus traveled freely. Here's a brief recap of COVID's east to west itinerary. Most experts agree that the virus leaped into human populations from a cave full of bats somewhere. That is a pretty firm statement because hundreds of similar coronaviruses are found circulating among bats. From the cave, the virus found its way to a large market in Wuhan, China, which brought together wild animals and people under crowded conditions. Very quickly, the virus made itself at home in that city. Wuhan has an international airport, and that airport has regular flights to all of the world, including Milan, Italy. Milan has always been a center for high fashion and the garment trade. China is where the actual cutting and sewing gets done, however, so flights between China and Milan are frequent. Thus, our new virus emulated a Depression-era hobo. It hopped on the first plane, went wherever, it didn't care, and it landed in northern Italy. As the epidemic started in Italy, it was ski season. Many Italians ski in neighboring Switzerland. So do other Europeans. Of course, the virus joined them on the slopes and for après-ski parties. Skiers from all over Europe mingled in those ski resorts. And pretty soon, the virus was headed all over the Schengen zone. No passport, no visa, nothing required. Very soon, COVID cases appeared everywhere in Europe. From the major population centers of Europe, it was only a 7-hour airplane ride for the virus to arrive in New York. There, it quickly became America's problem. So the virus travels. Everywhere it goes, it causes an outbreak that pops up like our simple model predicts. Obviously, our COVID models need to include the fact that the virus is moving from one target population to another. The simple models assume people are sprinkled about the landscape like dots on the picture shown here with no barriers in between them. In reality, people are geographically separated with some connections through travel. Even in one location, the population is divided by social and business stratification. Social divisions impede the virus, for a time anyhow. Lastly, once the virus threat is recognized, some people self-segregate to avoid the virus. They form disconnected pods with limited interaction with the broader community. Essentially, they are instinctively taking the strategy I recommended you follow earlier. I'm just trying to remind you to stick with it until imported infections are no longer a threat. I put some numbers against that advice earlier in this talk. Here's how I ran the simulation to get those numbers. I divided my total population of 300 million Americans into 6 subpopulations or communities that are interconnected. I must emphasize again, social network that the virus follows as it spreads has never been mapped. Nevertheless, a simulation can teach us about how the segregation of our population influences the outcome. For this simulation, I made 5 of the communities loosely connected in a chain of transmission. In all those 5 communities, the viral case reproduction rate was 1.8, the same. That is a guess of how an informed population will behave prior to the virus's arrival. The 6th community isolates itself even more from its neighbor, number 5. The 6th community maintains a case reproduction rate of less than 1. Such a community cannot sustain community spread. However, even this community is still vulnerable to imported infections from the other groups where the virus is spreading. To start the simulation, I introduced the virus to the first community. As the computer runs the numbers, we see the virus spread through each community and leak into the next. As a result, there is a cascade of virus outbreaks. In 5 of the communities, the outbreak continues until herd immunity develops. But in the 6th community, the low reproduction rate means that infections pop up by transmission from the 5th community, but any infections pushed into this careful community tend to die out without causing community spread because people take precautions. When other people become herd immune, the careful people have not acquired immunity to the virus, but there are no more infections coming at them from the outside. So the problem goes away like magic, as some people would like to say. The plots on the screen show you how the outbreak hits each of the 5 typical communities in succession. The first peak is lower and broader because the outbreak in this first group started with a few infections and grew naturally. The other peaks are higher and narrower because the infections were driven by large numbers of imported cases from a neighboring connected group that had a strong, large outbreak. In any case, the effect of dividing the population up into groups is clearly to extend the epidemic over a longer period of time. In this next slide, I plot the total number of new infections per day across all groups, that is, across the whole country, if you will. You can see that the effect of geographic and social divisions is to extend the time duration of the epidemic by blending smaller outbreaks that occur at different times. I've also selected out and plotted the new infections for the 6th and very unusual group that has a low case rate driven from its neighbors, but no community spread. As long as this group maintains discipline and caution, it stays out of the general epidemic. Now it is long past time to talk more about the popular topic of herd immunity. There are some subtleties to this topic. The general idea is that the virus runs wild until it infects enough people that susceptible people become rare in the population. Then the spread dies out. These plots show the percentage of susceptible people in a population during a simulated epidemic as a function of time. Clearly, all the curves flatten out and the epidemic ends, leaving some people uninfected. However, the worst case scenario is really bad. For COVID, we could have had an epidemic that was over quickly and infected most of the people. In fact, it hasn't been that bad so far. All of the available case data show that people did respond to the threat and did modify their behavior. With even small changes in behavior, it looks like we can get away with, say, only half the people becoming infected. But there is a catch in this optimistic picture. If we are cautious and slow down the virus without entirely eliminating the virus, then there are still enough susceptible people to restart the epidemic when the public returns to its original pattern of behavior. Pandemic fatigue could bring the virus back for a second run at us. Hopefully, we'll all be vaccinated by then. Let's say more about the herd immunity effect. We say a population has herd immunity when it won't sustain community spread. Community spread depends on the effect of reproduction rate, R effective. When that is less than 1, no community spread. The effective rate is never greater than R0. The effective rate is reduced below R0 by the fraction of people who are susceptible. Thus, for herd immunity, we must reduce the fraction of the population that is susceptible until it reaches a value less than or equal to the value of 1 divided by R0. Now, when R0 is 3, we need to get the number of susceptibles down to 33%. That means 67% of the people are immune. You've probably heard that in the news. If people take precautions and reduce R to 1.8, then the epidemic can die out with 56% of the people still susceptible, a very good number for this virus. If you already knew these basic ideas, you were probably surprised earlier to see that our models show so many people will get infected in an outbreak. For example, the black curve on the right of the screen shows new infections for the model with 6 subgroups. The blue line shows the percentage of people still susceptible. The blue line from the simulation descends and bottoms out during the epidemic well below the 56% level shown by the green line. That is a real discrepancy between these two predictions. The difference tells us something very important. If we approach herd immunity slowly, then we achieve herd immunity with fewer casualties than if herd immunity is driven by an unchecked viral epidemic. During a rampant epidemic, new infections continue to occur in great numbers after the effective reproduction rate drops below 1, simply because there are still a lot of infectious people out there, and these infected people continue to infect others until they recover. Let me review what I've learned through running simulations. I'll start with the last point. As a community, we reach herd immunity with fewer infections if everybody takes precautions and we approach it gradually. That will work out for hospitals too. Hospitals will be able to handle the serious cases if they are spread out in time. Next, I learned that any model based on initial parameters of this pandemic will predict worse results than anything we have seen so far. That's very encouraging. It means that in spite of all the defiance and moronic behavior and pure bullshit in the media, we as an intelligent species have reacted to the threat and taken steps to protect ourselves. Next, I learned that if anyone bothers to try and fit an exact model to the observed case numbers, they will need to measure and use detailed metrics for social interconnections. The curves for all my simulated epidemics were shaped by the assumed social connection parameters. And finally, the simulations drove home the importance of imported cases driving new cases. It will be hard for anyone to avoid all the risk when the virus is prevalent in a community. However, if someone can maintain strict preventative discipline, there's a good chance that person can wait it out until other people gain immunity the hard way. That was the message I started out to give you. You can survive COVID if you let someone else get sick for you. Be sure to thank them. If anyone wants to look at the parameters and code behind the simulations, they are on the web at the address shown. I've also put up there on the page the recent book that I can highly recommend. Be sure to check it out and read about how previous plagues have ended and how this one might end. That's it. I hope you live well, live long, prosper, and build a better world.